Alright guys, we are starting the final unit. This is going to be chapter 19 in our text. This is the diseases of the respiratory system. Of course, we are going to start with a little overview of the respiratory system. This one is a little bit shorter. And then you do need to know those 5 main things that we have gone over 110 times, but I'm going to do it 111. That is the microbe type for each disease, the causative agent, the transmission, the reservoir, and then those primary signs and symptoms, the ones that stand out. So for the exam, those are the 5 things you still need to know. There is still that template on Brightspace. You should be able to access that, and I would still study using flashcards. This is all just memorization. So here we go. So remember that in Unit 3 we talked about how the respiratory system is going to be that primary portal of entry because we're constantly breathing. Obviously, we have to. So this is going to be the main way that microbes get into our system. Now, the respiratory system is broken up into 2 distinct sections. We have the upper respiratory tract, which is the mouth, nose, nasal cavity, sinuses, throat, epiglottis, and larynx. And then the lower respiratory tract, which is the trachea and bronchi, bronchioles, and alveoli. And specifically, that lower area is going to include primarily our lungs. Now, we do have a handful of defenses because we need to make sure that the lower respiratory tract does not get any microbes, essentially, in that area. So we have nasal hairs, which serve a very distinct purpose of catching microbes as you inhale. We have a ton of mucus all up in our nose and sinuses and our throat. That is also going to act kind of like a sticky trap to trap microbes before it can get down into our lungs. And then when it comes to kind of a little bit lower into our upper respiratory tract and kind of the top of the lower respiratory tract, we do have these things called cilia. Cilia is made up of cells called pseudostratified columnar epithelium. These guys are going to be like little finger-like projections that are going to create little waves, essentially, little waves that move microbes up and out so that we can cough it out, sneeze it out, or it gets up high enough that we can then swallow those microbes and they can go die in our stomach acid. So let's take a look at that pseudostratified columnar epithelium. There they are, kind of those finger-like projections that are going to trap microbes and then move in these like little contractions that sweep microbes up and away from the lungs. That is their big goal. Now, we do run into a few problems here when it comes to cilia if you do certain habits. Those habits include smoking. If you smoke cigarettes or cigars or whatever, then you paralyze those cilia and make it to where they can't perform their function, and you have a higher risk of getting microbes into your lungs and therefore getting different respiratory diseases. Now, you might be thinking, but Rachel, I don't smoke cigarettes. I'm healthier than that. I vape. Well, dear listener, vaping is still not healthy. It's just water-based. Instead of you are burning tobacco and 100 other, like I think it's maybe 300 other chemicals in cigarettes. With vaping, it is water-based and the nicotine is more concentrated. What we are seeing instead of it paralyzing your cilia is it causes the tissues deeper in the lungs because it gets deeper, and you also breathe deeper when you vape. It causes the tissues to degrade into something called popcorn lung. And essentially what we see now, because we have had a little bit more time to research the effects of vaping on the lungs, is it ages your lungs faster. So just smoking and vaping in general, still not healthy, causes all kinds of problems. Now, when it comes to biota of the respiratory system, remember the upper respiratory system when we talked about sterile areas versus non-sterile areas. The upper respiratory system is going to be very much so riddled with microbes. We have a ton of microbes for our home team in those areas, which makes sense. We need it. They want to be there. We want them to be there. However, they can cause problems. We'll talk about it. But in the lower respiratory tract, we believed it to be sterile. However, there are potentially very low amounts of microbes growing in the lower respiratory tract. However, it is mostly sterile, just very small amounts of microbes. For this particular chapter, we are going to separate out the diseases based on location of where the infection is happening. So we're going to start high up in the upper respiratory system, and then we'll start to move a little bit lower as we move through the diseases. All right, let's start with pharyngitis. This is strep throat, something that most people have probably had. Very few people probably have not had strep throat, but this should be a microbe that we should recognize. That is Streptococcus pyogenes. It is a very common bacteria that causes strep throat. We talked about this in the last chapter, chapter 17, I think. And when it comes to strep throat, it can be caused by bacteria, primarily this guy, or viruses. Now, the viral forms are usually more mild and less painful. The bacteria can cause more issues. We'll talk about why here in the next slide, actually, with signs and symptoms. The reservoir is humans. However, this particular type of bacteria is normal for most people. And it's rarely an endogenous infection, however it can happen. The transmission is usually respiratory droplets or direct contact with mucus secretions. So maybe you're smooching on somebody who is sick or sharing a drink or something, but you come in direct contact with the secretions from their mouth. Prevention and treatment, there is no vaccine for strep throat. Just good hygiene and covering your mouth when you're coughing or sneezing, not sharing drinks, not kissing on somebody who is sick. For bacterial infections, now the big thing here with treatment is usually antibiotics, very commonly penicillin. All right, some signs and symptoms that we commonly see with strep throat is a sore throat, usually described as burning when swallowing, as well as swollen tonsils. Now, what we can visually see when someone has strep throat is typically white patches, which are streaks of pus in the back of the throat or on the tonsils. This is usually associated with a bacterial infection causing strep throat, whereas maybe we see red spots on the soft or hard palate, essentially in the back of the throat, but kind of up a little bit higher. This is usually associated with a viral infection causing strep throat. Scooting right along into the common cold. This is a virus. However, this particular virus can vary between a rhinovirus and a coronavirus. A coronavirus? We've heard of this before. Yes, that is a type of virus that caused COVID. Let's talk about it. Rhinoviruses are telling us the location that the virus is affecting. Rhino, meaning nose. Corona, if you didn't know this, in Latin is meaning head. So think about where you put a crown or a corona, something like that. If that helps you remember it, fabulous, fantastic. I love that for you. But typically a cold, the common cold, will be caused by a rhinovirus affecting the nose or a coronavirus, which is going to just affect the head in general. The reservoir is humans. Transmission is respiratory droplets or indirect contact with hands or fomites. So someone sneezes on a door handle, you touch the door handle, and then touch your face, or you eat something, and then now you are infected with that virus. The infection signs and symptoms are going to be classic cold things. You know exactly what to look for. You know, it's going to involve the nose, the eyes, the mouth, the upper respiratory tract, where we see maybe a stuffy nose, watery eyes, sneezing, sore throat, sometimes a fever, usually not. And depending on who you are, maybe it feels awful for a little bit of time, but it usually goes away pretty quick as well. So prevention is just good hygiene. Treatment, there is no cure, guys. And essentially what you can take off the shelf is antihistamines. And yes, antihistamines are exactly what you take for allergies. Now, it's just different packaging if it says cold and flu. So maybe you're paying more for it, but essentially it is the same medication that you would take like for your seasonal allergies. But this will only provide relief. It is not going to treat the virus itself. Now, there is maybe a little bit of something to taking zinc very early on when you get sick to help shorten a cold. However, there are very few things that are going to help with a cold. We talk about this a bit in class, but the placebo effect is kind of primarily where the cold comes in. So drinking orange juice or hot tea or peppermint or things like that. Essentially, you're kind of thinking it's going to work, so you think yourself into feeling better. Fun fact, orange juice actually can make a cold worse, and it has to do with the acid in the orange juice itself. Oddly enough, just found that out literally yesterday. So kind of some interesting things about the common cold. Now, let's move into a sinus infection or sinusitis. So this can be bacterial, viral, sometimes fungal, maybe it's linked to allergies, but this is the inflammation of the sinuses within your face. Sounds weird, weird statement to make. But the transmission is going to be dependent on what the microbe type is. And I don't have a specific causative agent for you here because there's all kinds of different microbes that can cause this, so I don't have a specific causative agent. But it could be direct or indirect contact, endogenous, it could be accidental inoculation, it just depends. The signs and symptoms are all kind of the same though, and it is the inflammation of the cavities that we find in your face. So on either side of your nose, as well as above your eyebrows, between your eyes, we do have these cavities which serve the purpose of warming and moisturizing the air that you breathe in, as well as it reduces the weight of your skull because they're basically just cavities in your skull, which is kind of interesting. However, the drains or ducts that allow for your sinuses to empty essentially into your throat, because that's where essentially everything in your face empties into is your throat, so you can swallow any secretion from your face. Sounds weird, sounds gross, but it's true. These ducts can get a little bit clogged, and what can happen once these ducts get clogged is pressure in your face. The prevention is essentially hygiene for viral. There are no other preventions for the other microbe types. Treatment is none for viral, antibiotics or antifungals for the other microbes, and possible steroid sprays if things get worse. However, one of my recommendations, not on this slide, but my thing to kind of be a PSA to you, is if you have a sinus infection, I would avoid using a device, usually called a neti pot. but it is a device that you would use to empty your sinuses. So you would use something like distilled water. That's very important. Distilled water or treated water, and you would shove it up one nostril and then you spray, and then it flushes out your sinuses. It is intended to give you relief. However, many people do this incorrectly or use improper techniques and water, and it can cause more issues in the face of this. Already you have a problem because you have an infection. So, little PSA about cyanitis. All right, let's talk about ear infections. We have otitis media, which is a type of bacteria or viral infection. We have two causative agents here, Streptococcus pneumoniae and Haemophilus influenzae. So these two microbes can cause meningitis, is one of the things I want to get across here. If they get into the wrong area, they can cause meningitis. The reservoir is humans. Prevention is going to be a vaccine, but kids under 2, I don't think can take that vaccine, which sometimes we see children contract ear infections pretty frequently. So we will talk about this treatment a little bit more here on the next slide, so we'll get to it. But other treatments might be antibiotics or antivirals, and then let's talk about implanting ear tubes. And I think this goes better with the images, so let's talk about it. All right, so if we look at these images, we can see that there is this middle ear area. It's where your auditory bones exist. It is just past your eardrum, and it is past your ear canal. So where you stick a Q-tip, it's past that area, all right? So if that area becomes infected with fluid, potentially this other structure that allows this middle ear to drain, called the eustachian tube, becomes blocked. And in children, this eustachian tube can be particularly small. It can become blocked pretty frequently. So what happens is we may surgically put in a drain so that kids don't get those ear infections as frequently if they are prone to getting ear infections, because typically an ear infection is going to be caused as a secondary ear or a secondary infection. So sometimes you might have strep throat first, and those microbes crawl up that eustachian tube because the eustachian tube just empties into the throat. So if you have strep throat, then it's just a hop, skip, and a jump to get up to your ear. And then suddenly you have all of this fluid. Maybe it's pus, maybe it's sebum, earwax essentially, all building up in there. Maybe white blood cells and other cells, who knows. But you have this buildup in the middle ear causing pressure and pain. So that can always be a secondary infection, and typically you see strep throat and then an ear infection popping up in kids. So again, it's going to cause that pressure and pain, not a good time. Now, I did have a student ask me a very great question in class the other day, and I didn't have an answer at the time, but I kind of want to talk about it here because we're talking about an ear infection, and that is, what is swimmer's ear? Well, swimmer's ear is not this middle ear infection, which is otitis media, but swimmer's ear is an infection of the ear canal. So it's the more superficial part of the ear, so just before that eardrum, not after the eardrum where we see the auditory bones, but it's more superficial as far as an infection goes. So forgot to answer that question, but now you guys get to benefit for it forever. All right, on to diphtheria, which is a bacteria microbe type caused by Corynebacterium diphtheriae. The reservoir is humans. The transmission is respiratory droplets. The treatment is antibiotics with antitoxins because this particular bacteria makes a toxin. We'll talk about it. The prevention is a vaccine called the DTaP vaccine. So the D in DTaP is representative of this particular disease. Now let's talk about the complications that this particular disease can cause, which is pretty nasty. Now, what we're seeing is this bacteria emits a toxin that can kill the cells at the back of the throat, but as it kills those cells, it causes the cells to release fibrin, and fibrin normally will cause clotting, and that is what is essentially happening at the back of the throat, where we see essentially this pseudomembrane or a net made out of the fibrin from our dead tissues and bacterial swells, as well as we can see swelling in the tonsils as well as the back of the throat. The concern here is that this swelling and this pseudomembrane, this net of fibrin and cells, is that essentially it blocks our airway and we suffocate. So this is kind of scary when it comes to this particular disease and this microbe, this particular symptom. This is a newer ability that this microbe inherited from a bacteriophage that infected it. And now we see this complication arise in us where diphtheria can release this toxin and then cause this pseudomembrane across the back of our throat, which is kind of terrifying. So this is a little bit newer of a thing that diphtheria can do. But yeah, little bit scarier and a little bit more of a reason to get that DTaP vaccine. Alrighty, we are moving lower. Now we're still kind of in the upper respiratory system. However, we're going to dip down just a teensy tiny bit. Naturally, we are going to start with COVID-19. Now, we are far enough away from the pandemic that we feel comfortable talking about this. At least, maybe, hopefully we do. However, this is something that should still live pretty fresh in most of our minds over what happened during this lovely time period that we all got really close. Now, the microbe type for COVID was a virus. It is the SARS-CoV-2 virus, which is a type of coronavirus. Remember, coronaviruses are going to affect the head. The reservoir is humans. The transmission was respiratory droplets, direct and indirect contact, which made it very easy to transfer from person to person. The other thing that helped with that transmission was the incubation period, as well as after you stopped showing symptoms, you were contagious that entire time. So before you showed symptoms during the incubation period, you were contagious. 8 to 10 days after you stopped showing symptoms, you were contagious. There was also a lot of misinformation as far as when you could go back to work or go back to school or start being social again. Unfortunately, what we know now is that you're contagious for every single moment that you have the virus, whether you know you have it or don't. And that's what makes this particular virus pretty dangerous. So the prevention is the COVID vaccine. However, what we are now seeing is that this virus is mutating into different strains, which is not dissimilar to influenza, which we'll talk about here potentially the next one. That is the next one we are going to talk about. There are different strains of the flu. We are now seeing different strains of COVID. So what may happen during flu season is it will also be COVID season. And what you may have to get is some type of booster to prevent you from getting COVID during flu season. Treatment is antivirals, potentially more severe situations where like individuals who are immune compromised may need supplemental oxygen. It just kind of depended on if you were particularly healthy before you got COVID, you probably had less severe symptoms, would need less severe treatment. If you were immune compromised, you may have had more severe symptoms and would need more intense treatment. Most of us probably remember a lot of signs and symptoms to look out for. The big one was a fever, sore throat, trouble breathing. I know the ones that I remember were the fatigue was the big one when I caught COVID. And there was also a lot of brain fog. I don't remember having that, but I know a lot of people who did. And it was just this very intense kind of like you were almost disoriented for a very long period of time. It's like you couldn't catch a thought, essentially. And yet it was also hard to catch your breath. There was also a change in your sense of smell and taste. And then there were also less common symptoms of like diarrhea, nausea, and vomiting. But the big ones had to do with a lot of the respiratory abilities, as well as having brain fog was kind of the big one. I promised it, now here it is. Influenza. This is a virus. Now, something maybe you didn't know, or maybe you did, fantastic, love that for you, is there are 3 kind of categories of the causative agents of the flu. We have influenza A, influenza B, and influenza C. And in that descending order, we do have more severe to less severe. Influenza A is where we see a lot of strains of influenza that are kind of the big scaries. Now, amongst these 3 different causative agents of this virus, there are roughly 40 different strains that fall between them. So why do we have so many strains of influenza? We will talk about that. All right. So the reservoir is humans and animals. And I guarantee you've probably heard of where we see influenza in animals like bird flu or avian influenza, and swine flu was kind of the big one for quite a while there. Transmission is respiratory droplets or indirect contact. Signs and symptoms, we've got fever, chills, headaches, body aches, dry cough, stuffy nose, sore throat, fatigue, and the very big important thing, guys, is no tummy problems. So no intestinal effects. When we talk about the stomach flu, that is different than influenza. That is a very big misconception. When someone talks about having the flu, they might be talking about having the stomach flu, but they could be talking about having influenza. We just, there's kind of this misconception that they're the same thing, but they aren't. Influenza has to do with the respiratory system. Stomach flu is going to be all kinds of nastiness happening, maybe a little bit more south. Maybe you're throwing up too. Who knows? We'll talk about that actually in the next chapter. So stay tuned for that fun stuff. Prevention of the respiratory flu, influenza, is going to be an annual vaccination. Now, people have kind of learned to mistrust this particular form of prevention. Unfortunately, it's due to the fact that healthcare professionals are essentially guessing at what strain out of 40 is going to be the most popular in the next year or maybe in the next 2 years. It takes multiple months and years to make enough of the vaccine in order to distribute that to people, like our population, right? So essentially, there may be a lower efficacy or effectiveness of the vaccine in certain years or certain seasons because we pick the wrong one. So that leads to a lot of mistrust where, oh, I got the vaccine for the flu, but I still got the flu really bad. Yeah, unfortunately, it's because we had to hedge our bets and guess which strain would be popular, and we were wrong. Unless you're Nostradamus, and even he was just making guesses, it's hard to predict the future. We don't know which strain it's going to be and if it's going to be effective to make the vaccine for that strain. The treatment, if you get the flu, influenza specifically, is to take an antiviral, essentially, by the second day of the infection. However, most people don't show symptoms by the second day, so they don't know they're sick. So running to the hospital is not going to be super effective by that second day, unfortunately, just because most people don't know they're sick by that second day and don't know they need to take those antiviral drugs, making them almost essentially useless. It's hard to catch it that early. All right, y'all, let's answer this question of how did we get here with these different strains of the flu? Why do we have to take a different flu vaccine every year? Why is it not always so effective? Why is the big question here. The answer is influenza, as far as the virus goes, is real sneaky beaky as far as changing its physical appearance on the outside structure. Now, if this virus changes specifically two things about the outside of its structure, specifically the N spike and the H spike. Now, that's all you need to know. That's all I care for you to know is the N spike and the H spike. If it changes those two physical structures on the outside of itself, then our immune system can't recognize it. So if you get the vaccine and maybe you get the flu and all that good stuff, your immune system remembers that virus. It remembers that microbe. However, if the virus changes that N spike and the H spike, then essentially it's camouflaging itself and it makes it to where our immune system can't recognize it and it becomes a different strain, essentially. But the big thing here is our system can't recognize it. You can get sick again. So the big thing here is viruses are really known for their constant genetic changing, and influenza is probably the biggest offender of that, or the biggest virus that embodies that particular statement, maybe is a better way to say that. Influenza can do these two things, antigenic drift and antigenic shift. And whoever named them needs to get a polite slap on the face, because why would you name them things that are so close together? Either way, guys, I'm so sorry. They're called practically the same thing, but they mean different things, and I need you to know what they mean. Antigenic drift is going to be that modification of those H and N spikes that we just talked about. Antigenic shift is going to be a change in the genome. So let's say you've got this influenza strain that jumps from a human, and then it's the avian flu, and then jumps back to humans. The virus now has that genome that embodies some of that avian flu, right? That is part of its genome, that big makeup of its genetic information. Now we have it, and part of the virus that we now have has some of that genetic makeup that says it infected birds or ducks or specific birds, whatever it may be. But it's essentially a change in the genome, and it is usually those viruses that can jump species, which is kind of scary. But it still makes it to where our immune system is still kind of confused by those changes as well. All right, on to pertussis, or whooping cough, which is arguably one of my least favorite of the respiratory conditions, because it just makes me angry when kids get this, for no other reason that there's a vaccine, and it sucks when children get this particular condition. The microbe type is a bacteria. It is Bordetella pertussis, which if you have puppers, you probably recognize this if you've ever taken them to a kennel. There is a similar causative agent that causes kennel cough in dogs, but we can also prevent that with a vaccine as well, oddly enough. In humans, or humans are the reservoir, the transmission is respiratory droplets. Like I said, the prevention is that DTaP vaccine that we discussed earlier with diphtheria. This is now the AP, the app part of the vaccine title. And the treatment is antibiotics if you contract whooping cough. Some signs and symptoms. It starts in the upper respiratory tract and causes things to move down further. The first stage of pertussis is usually like a common cold, sneezing, running nose, etc. It's that second stage that's going to be kind of the issue. It's the paroxysmal stage. Now, this is where whooping cough gets its name, unfortunately. You are coughing so hard, you cough out all of the air in your lungs to the point that you kind of convulse into these seizing coughs, and also trying to get air into your lungs, you are now suffocating, and it causes this wheezing, whooping noise to essentially emit from your body because you are gasping between coughing bouts, essentially, kind of these spasms to suck air in, and that is where pertussis gets its common name of whooping cough. It has to do with the sound you make as you struggle to get air into your lungs. Now imagine that this is a child struggling to get air into their lungs because they have contracted this microbe. Unfortunately, what happens is because their little bodies are still developing, these coughs are so intense that they can break their ribs, which is atrocious to think about. Now, if this individual makes it through that second stage, there is still a big concern because with those incredibly violent bouts of coughing, even if you are recovering and you've essentially beat the bacteria, now you have all this ripped up tissue in your lungs, your trachea, your throat, and that can lead you to a secondary infection. So as you are recovering in that convalescent stage, that third stage of whooping cough, you've beat the bacteria, but you have this very high risk of contracting another infection, which, kind of insult to injury there. We've got good news, we've got bad news. Good news is whooping cough has massively gone down in the last 100 or so years as far as how many cases we've seen. The unfortunate news is with the fear of vaccines, we are seeing a massive kind of spike compared to previous years where people aren't getting the vaccine, and whooping cough is starting to make its rounds again. Unfortunately, I think you have to be a certain age, roughly 2-ish, I want to say, in order to get the DTaP vaccine. And that means that children, infants underneath that age limit are susceptible to getting that particular bacterial infection. So even if you plan on vaccinating your wee ones, individuals who didn't can still spread that particular bacteria and get your little ones who are not old enough to get the vaccine sick before they can get the vaccine. And then all kinds of nastiness ensues, and potential death. So kind of the bad news there with that. Next up is RSV, or Respiratory Syncytial Virus. Try saying that 5 times fast. This is a virus, as I just stated, and it is caused by that specific virus, or RSV. The reservoir is humans. The transmission is respiratory droplets and indirect contact. The signs and symptoms are kind of normal respiratory infection type of symptoms. However, you have a tendency to form these giant multinucleated cells called syncytia, which are basically the cells are glued together. This can cause difficulty breathing because they form in the lungs. Otherwise, the symptoms are similar to a cold, similar respiratory infection cold symptoms. But because of these glued together cells, it can cause this kind of forced breathing or belly breathing. The prevention is that there is not really a publicly available vaccine. However, to individuals who are more high risk, so kids or pregnant people, there is antibodies or another vaccine essentially that is available, but only to individuals who are at a higher risk of contracting RSV. The treatment is an antiviral. But it is mainly used for individuals who are more critical. However, most people do not have these critical conditions. Just people who are usually immune compromised. But if you're generally a healthy individual, you contract RSV, you'll probably have more mild symptoms. Okay, finally moving into the lungs, we are moving into the lower respiratory tract. Starting with a disease you've probably heard of, and that is TB, or tuberculosis. This is the microbe type bacteria, which, fun fact, before I took microbiology back in the day, I thought tuberculosis was a virus for sure. And when I heard it was a bacteria, that absolutely blew my mind. The way people talked about tuberculosis, I thought for sure it had to be a virus. But it is caused by Mycobacterium tuberculosis. The reservoir is humans, transmission is respiratory droplets. Now, it does have two forms, a latent form and an active form. And what's really funky weird about tuberculosis is that in the latent form, compared to other infections, it's not contagious. So you still have the bacteria living and growing inside of you, but you're not showing any symptoms and you're not contagious. We'll talk about why here in the next couple of slides. In the active form, you feel sick, you experience symptoms, and you are contagious. So let's talk about what's happening in these latent and active forms of tuberculosis. I apologize, there was some issues with my microphone, but I think I have it worked out now. So let's look at what's happening with tuberculosis. So this microbe is growing inside of the lungs. So it is a microbe that gets down into that lower respiratory tract. It is in the lungs in an alveolus, and we have the production of that bacteria. Now, our white blood cells are going to look at that and say, yo, you shouldn't be here. Time to leave. So our white blood cells go and attack those microbes by consuming them. Now, tuberculosis has this particularly fabulous, for it, not for us, but fabulous ability to survive being consumed by our white blood cells. So what happens is in this infection, the white blood cells all start consuming these bacterial cells, and it creates this big clump called a tubercle. Now, the white blood cells are all clumped up full of these microbes, this bacteria. Now, the bacteria is not dead, and what happens is the white blood cells form kind of like a shell from that clump of white blood cells called a tubercle, like we were just talking about. Now, in this tubercle, it's kind of like a protective cocoon, if you want to think of it that way, where on the inside, the white blood cells become or are destroyed essentially by the bacteria. And the bacteria then start to reproduce in this hollowed out shell of the white blood cells, all clumped up together. Again, like a cocoon made out of white blood cells. At this time, this is that latent phase where you have the microbe inside of you. It is reproducing, it is growing. But because it is within this tubercle of white blood cells, our immune system can't see it. It's hidden. And because the microbe is contained inside of the tubercle, you're not spreading the microbe. So that bacteria is stuck in the tubercle, reproducing until those microbes grow to the point of rupturing that particular tubercle and then break out, and kind of like a real disgusting popping of a balloon, the bacteria spreads and you're in that active phase. So you're coughing, you're hacking and spreading the bacteria. But you have to have that tubercle full of the bacteria, and then it pops open, and then you are now contagious. Unfortunately, what these tubercles leave in the lungs is a lot of necrotic tissue. It ends up killing our lung tissue. What our lung tissue should look like is nice, fluffy, and pink. And unfortunately, what those tubercles leave is basically dead lung tissue. So that is kind of the bad news there. The good news is we do have prevention in the form of a vaccine. We do have treatment, which is the form of antibiotics. The flip side of that, however, is that with that treatment, it is multiple months of multiple antibiotics. Now, a lot of people can't even take a week's worth of antibiotics properly, let alone several months of several different drugs properly. And during this time, you're having these tubercles form, these kind of like shells, and then they pop and open up, and then they form another shell, and then they pop and open up. So it's this constant kind of cycling of this situation as you're trying to treat it with these antibiotics, because in the tubercle itself, the antibiotic doesn't work against it because our white blood cells are essentially protecting the microbe from the antibiotics, which sucks. Now, if people don't follow their antibiotic routine that is set in place by a health practitioner, what we get is really strong strains of this bacteria that is antibiotic resistant. And that is essentially where we are now. So here are some of the countries and areas where we see a lot of these really strong strains of tuberculosis. You'll notice that the US is not part of that. However, people do travel to these areas. I would highly recommend getting that prevention if you plan on traveling to any of these places with these very strong strains of tuberculosis. Get the vaccine, get that prevention measures in place so that you don't contract tuberculosis. That is to say, we still get tuberculosis in the US. Now, people in the US who get tuberculosis, this is not those really scary strains of tuberculosis. These are very treatable strains of tuberculosis still. However, that doesn't mean that if you travel that you're not going to bring it back with you. And that's kind of the concern. Now, tuberculosis is one of the world's deadliest diseases, and at one point in time, it was like the leading cause of disease-related death in humans, only to be beaten out by the plague at one point in time, by the Black Death. So tuberculosis is a pretty nasty disease to get. It is highly contagious, and you're stuck with it for a long period of time. Again, it cycles through that shell popping, over and over, basically destroying your lung tissue. Okay, on to pneumonia. Pneumonia can be caused by all kinds of different microbe types, but the signs and symptoms are generally the same, where we have this inflammation of the lung tissue, filling of fluid in the lungs, and that leads to chest pain, shortness of breath, coughing, sometimes coughing up a bloody stained or rusty phlegm, or sputum is sometimes what we call it. Kids can be pretty susceptible and have a higher risk of dying from pneumonia. It just depends on the type of pneumonia. Now, we are going to clump pretty much all pneumonia into one category of pneumonia, but know that that is kind of like all the signs and symptoms are pretty much the same. Individuals who have a weakened immune system are more susceptible to death. And there is just a little bit more I want you to know about it on the next slide. There are two categories of pneumonia that you do need to know. Community-associated pneumonia, which is going to be you're just living your life and then something gets in your lungs and it causes pneumonia. Versus healthcare-associated pneumonia, where a individual in the healthcare field is maybe placing a breathing tube, a feeding tube, maybe giving a tracheotomy, and they move part of our home team into a place where they shouldn't be, into the lungs. So the most common mode of transmission for healthcare associated pneumonia is an endogenous transmission. So an individual in the healthcare field is placing some type of tube into your lungs, and a microbe from our home team gets into our lungs. That is the other most common way to contract pneumonia. So know those two categories for pneumonia. Next up is histoplasmosis. This is a fungus microbe type, and specifically it's a dimorphic fungus, which is a type of fungus that can change from a yeast to a mold, caused by Histoplasma capsulatum. Sure, that one. And the reservoir is the environment, specifically where we see bird and bat droppings. This is where the fungus likes to live. Now, transmission is maybe you're hiking or caving or doing something and you kick up some dry bird or bat duties, and those spores become airborne and you inhale the spores. The spores get into the lungs, causing acute or sudden pneumonia. So people who are immune compromised are going to be the ones that this could lead to being fatal. Maybe lesions on organs. This can be an issue for people who are immune compromised. If you are not immune compromised, you're a generally healthy individual with no underlying problems, you're probably going to be fine even if you inhale these spores. Prevention is avoid areas where there's bird and bat droppings. And if you're immune compromised and you know this, and you're going to be in these areas anyway, make sure you have respiratory protection. The treatment is going to be antifungals because this is a fungus, but remember when it comes to fungal infections, this is the same cell type as us. They can be kind of hard and tricky to treat. Now, if you are a resident to the Midwest, you're going to notice on this map that, gosh golly, histoplasmosis is pretty common all around us. So Missouri, Illinois, and the associated states around us. So just be careful if you are hiking or caving in these areas. Wear the proper protection and understand that histoplasmosis is something that can be inhaled if you kick up bird and bat droppings. Last but certainly not least is anthrax. Now, you might be saying, but Rachel, we've already talked about anthrax. Why, yes, my students, you have with cutaneous anthrax, but there are 3 possible ways for anthrax to get into our system and cause a problem. We talked about cutaneous anthrax with that first disease section with the skin. This is going to be the same microbe, bacteria. It's the same microbe type. It's a bacteria, same causative agent, Bacillus anthracis. It is a gram-positive endospore-forming aerobic bacterium. It is usually found in the environment, but depending on how it gets into your system is going to be how big of a problem it can be. So prevention, there are vaccines. It's the same across the board for all transmission types, and the treatment is antibiotics except for this one. We'll talk about why. We already discussed cutaneous anthrax in chapter 16. This is where the endospores enter through a cut. There is a 20% mortality rate. The gastrointestinal anthrax, this is consuming anthrax, has a 50% mortality rate, so that is increasing, super scary. However, inhaled anthrax, the one we are talking about here, has a 100% mortality rate. That is what makes it so gosh darn scary, is that if you inhale this bacteria, you are going to die. That is a very severe statement. It's very scary to think about, but that is the thing about it. It's very severe. So the thing that we can see as far as signs and symptoms go, it's going to vary based on the type of anthrax, particularly the type of transmission. All can become septicemia, meaning it infects that blood. However, for inhaled anthrax, you get cold or flu-like symptoms until you get shortness of breath, fatigue, and muscle aches, and that will lead to death. There are unfortunately no ifs, ands, or buts about it, but the starting symptoms are cold and flu-like. And with that, dear students, that is the end of the respiratory diseases. So that is chapter 19 for us. So I hope you enjoyed it. Remember to be studying because this is all just memorization. If you have any questions at all, please don't hesitate to reach out. I am here for you guys, and make good choices.